What is up, guys? Dr. Tochi here. Welcome back to the channel. If you guys are new, I'm Tochi. I'm an internal medicine doctor, graduated from medical school back in 2021, and graduated from internal medicine residency back last year in 2024. So this video is to talk about everything step 3 related. So if you guys haven't seen my step 1 and my step 2 videos already, those videos are related to my experience and advice. Like this video is going to be for like step 3. So the first thing that I want to talk about in terms of step 3 is how hard it was in relation to step 1 and step 2. Personally, I thought step 1 is and always will be for me going to be considered the hardest. And then I thought step 3 is probably right beneath that. And step 2, with that being at the bottom, with me feeling the best after taking step 2. And it was also reflected in my score as well. I would say that the reason why step 2 goes after step 1 in terms of difficulty, one is because of the circumstances of taking the exam. For me, I had it taken during my first year of internal medicine residency. So the ability to be able to find out a good time to study for it, as well as picking out a good time in the year that didn't conflict with a lot of hard rotations during my residency experience, made that very difficult. So preparing for it and actually taking it was pretty difficult. Usually whenever I prepare for these exams, like I did for step 1 and step 2, I go through the UWorld question bank twice, and then I go through all my wrongs. But because of how time constrained it was for this exam, I was only able to go through UWorld once and my wrongs once. I didn't feel as confident walking into the exam just because I didn't follow my normal procedure on my normal process. But I do feel that there were other components that made it a little bit easier than step 2. I think because of all the MBMEs and all the little bit more dedicated time I got to spend in step 2 studying, as well as the experience of already taking step 1, I did feel that taking step 2 was a lot easier, but for step 3, it wasn't the case. In terms of my advice for this exam, the first thing that I would say is that if you have the opportunity to take the exam before residency, please do it and just get it out the way. For me, I had about a month and a half after medical school to residency starting for me to actually have a period to take it. But for me, I didn't want to spend all my time studying in that break and taking an exam in my break. And honestly, to this day, I regret it. Thankfully, I don't regret it too much because I did pass it on my first try. But in terms of all the stress that it caused and all the extra work that I had to put in and the fatigue that went into actually studying for the exam, if I just took it before residency started, then it probably would have been a much pleasurable experience. In terms of my second piece of advice for the actual exam, I would say that the CSS cases, which is something that is different from both step 1 and step 2, which are pretty much live modulated patients that you need to work through and actually do orders and talk about what you need to do for following up, whether it's like in a week, in a day, and like whatever. The actual CSS cases, you can't just walk into the exam without properly knowing how is the setup going to be, how is the actual exam going to be, what are the different types of cases that they actually study. So utilize the one that is on UWorld, and then I believe the MBME website also has their own mock CSS cases that you can do on there as well. So do as many cases as you can on there, because that's the one thing that I would say differentiates from step 1 and step 2. So you don't want to just walk into the exam blind and not knowing how the setup looks like and what you should be doing on there. There is a video that I looked at on YouTube a long time ago. I'll see if I can find it and put it in the description box down below. But there's a lot of tips and tricks that you should be wary of to do for every single case for the CSS cases. That way you can get the best score as possible. In terms of my actual test day, it was separated between 2 days. That's another difference between step 1 and step 2. The first day was completely all questions. That pretty much felt the same as when I was taking step 1 and step 2. But the second day was split between half the day was questions, multiple choice, like the previous day, and then the other half of the CSS cases. I'll say in terms of the day that felt most difficult for me was probably the second day. I personally felt like the questions on the multiple choice section was much harder than the first day. And then I also feel like the anxiety of not knowing if I actually did the CSS cases correctly, because you don't really get defined time of how much that it will give you. You'll be working through the case. Sometimes the case will just end, or sometimes they'll be working on the case for quite some time, and you can't really gauge on whether or not you did it right until you get your score back. Another portion that made this exam a lot more difficult than step 2 is that there's a lot more biostats, a lot more ethics, and they weren't easy ethics questions. They were a little bit more nuanced than what I'm usually accustomed to. Usually, the ethics questions on these USMLE exams aren't that bad. That was a difficult portion. And then also the biostats. I thought the biostats was probably the hardest portion of the exam. So do not forget to study all those formulas and seeing in the question banks, how do they actually ask these questions? Because they don't ask you like, what's the attributable risk reduction? They don't ask you like, what's the number needed to harm, the number needed to treat, what's the sensitivity, specificity. They'll put it in a very, very specific way in the question where it's like, okay, this is what they're actually asking for. And then from there, now I have to know the formula. Now I actually have to know what goes where. And then you can answer the question. That is something that I underestimated. And although I kind of breezed through the formulas for biostats, I didn't really look at a lot of the questions to see whether or not I was actually understanding what they wanted me to answer. And I felt that because it was a lot portion of the actual exam, I didn't feel as comfortable, especially the second day, which is where I felt there was a lot of biostats on there. So don't sleep on the biostats. Other than that, you guys know my method for studying for these USMLE exams. I don't change my answer after I select it. If I don't know the answer, I don't click anything. I'll just keep on pushing and come back to it later. Allow my brain in the background and my subconscious in the background to actually work on the process. And then when I actually get back to the questions, oftentimes I'll have like a different perspective, and sometimes other questions will kind of tip me off as to like, oh yeah, this is what actually that answer was in that previous question. I'll come back and it's there. Use the strike options, and then also do not change your answers. That is my first philosophy. I got that advice from a doctor and some other people in med school as well. And oftentimes you'll be surprised looking at UWorld if you see there's a portion where you can check to see if you change from incorrect to correct, correct to incorrect, or incorrect to incorrect. If you see how much you're changing and how much it affects, oftentimes, at least for me, I was oftentimes changing my correct answer to an incorrect answer more often than I was changing incorrect answers to a correct answer. So you really got to just play the numbers and just pick your answer, be confident, move on, and don't ruminate on it and just thinking that you need to go back and change your answer, because oftentimes you're just going to change it the wrong one. So overall, that is some of the biggest advice I would give for step 3, and that was my experience in taking it. The differences in the actual like blocks, they weren't really much different from step 1 and step 2, still 40 question blocks. But overall, that is my advice. If you guys enjoyed this advice, or if you guys have some more advice for others in the comment section, you can go ahead and put them down below if you guys already did it. And if you guys want to check out my step 1 and step 2 videos, go ahead and check it out in the description box or in the top right hand card of this video. I hope that was useful information. You guys are going to pass these exams. I know they can be really anxiety provoking, but you guys, if you put in the work, you do the questions, and you put in your due diligence, your body and your mind is not going to let you down. So I'll see you guys later. Peace. Have a nice day.